Guys, welcome back to Medical Coding with Blue. Today's episode is all about talking about your transferable skills as a new medical coder. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, if you have just gotten your certification and you say, well, Blue, I'm not coming from a medical background. I'm coming from a background from the service industry. I have nothing to do with coding. How can I make my resume look good? Or Blue, I'm coming from a coding adjacent position like billing, and I've never done coding, but I've done all of these other tasks. How do I translate that into transferable skill for a coding position? Fear not, guys. Today's episode, I'm going to be talking about that. Sometimes we have more skill and knowledge than we recognize as somebody who's brand new, okay? And that's something that you have to know. Also, what you have to know is that you're bringing in skill. You're not bringing in nothing. You're not somebody off the street. And you have to stop looking at yourself like, well, I need an entry-level position. Every position that you will ever get, even when you do have experience, is going to be at the beginning. Even if it is an advanced position, they're going to know that you're brand new, okay? So there's going to be a lot of things that you're going to be learning while you're on the job. But the core thing that you're bringing over is your knowledge about coding, okay? And now, how do we highlight this? Of course, we're always going to go back and talk about the resumes. I have plenty of videos on my channel talking about resume tips for brand new medical coders. But here's something that I really want to stress in this video. Resume should be on one page only. And a lot of times when people are writing down their skills, and I'm going to point specifically to the skills in this video, because here's the thing, guys, you don't have to have 50,000 skills on your resume. You can look at the job listing and what is it asking for? Candidate must be knowledgeable in ICD-10-CM, CPT, HCPCS. If it's for an inpatient position, ICD-10-PCS. Okay, if you don't have ICD-10-PCS knowledge, don't put it on there. Don't worry about it, okay? But if you have ICD-10-CM, which is your diagnosis coding, and you also happen to have ICD-10-PCS knowledge, don't ever put onto your resume ICD-10-CM/PCS. Why? Because this may be the reason that you are getting rejected on your resumes, and your resumes is not reaching the hiring manager. Why? Because, of course, everything is artificial intelligence. And so artificial intelligence, a lot of these things are going to an ATS reader first. When you submit a resume, it's going into this ATS reader. The ATS reader is looking for specific words that it is programmed to look for based on that job listing, right? So if you are putting on there ICD-10 and nothing else, immediately, okay, this candidate does not meet our skills level. Because why? The system is not looking for ICD-10. It is looking for ICD-10-CM. It is looking for ICD-10-PCS if it is called for that job. Okay? So that's why I say if you're putting ICD-10 and nothing else, immediately, that's wrong. ICD-10-CM/PCS, again, lazy and wrong. Okay? Because again, it needs to be two different lines. These are two different things. And for those of you that don't understand that, I feel sorry for you. Because I always get griped at by somebody that doesn't know. And they're always trying to tell me like they know. Okay, first of all, this is my industry. I've been in it for 16 years. So I understand it forward and backward. I do these videos to help people. All right? Now, the message may not come out like you want it to. And that's okay. Because some of you are just too wanting to be too coddled all the time with, oh, it needs to be said like this, said like that. Guys, it doesn't. It doesn't. I'm being very straightforward with you all because that's what works. And that's what seems to help a lot of people. So again, don't do that. Don't do ICD-10-CM/PCS, okay? I see that a lot on LinkedIn, and that's very lazy. It's very lazy, okay? And it's not efficient. It's not efficient because there's no such thing as ICD-10-CM/PCS. I'm just saying, okay? Now make sure your skills look right. You don't have to have 50,000 skills. You have to have the basic skills on there, all right? I don't want to see organized. I don't want to see team player on there. I don't want to see analytical on your skills list either. These are all considered soft skills. That's what your cover letter is for. That's what you can talk about in your cover letter because that's where you're doing this human draw for the employer. And for those of you that say, well, I heard we don't need cover letters. Cover letters that are like a form letter, absolutely. I would agree with that. You don't need that. That's ridiculous. This needs to be updated for every single position that you are applying for. And again, don't complain about having to update your cover letter and your resume for the job title on your resume that you're trying to apply for, because no employer wants to feel like they're just part of a mass, like just putting out resumes here and there willy-nilly. Okay, they want to see intentional. That's showing who you are as a person. Are you intentional? This also goes to character. People who are very intentional about what they're doing are more likely to stick with whatever they're going and they're doing. Okay, and the more you're likely to have that stick-to-itiveness, the more successful you're going to be, because this is a person that's going to know to do the research. This is a person that's going to know that they have to take the initiative sometimes to look things up. All right. And for those of you that are harping about, oh, I want an entry-level position, every position that you will start in as a medical coder is going to be entry level. Okay, even when you do get experience, because guess what? Even experienced coders don't have experience in every single clinic. All right, so they're going to be entry when they go in, right? Even though they're coming in with experience. So let's get off of the oh, I want an entry level position train. Okay, take that off your resume, especially if it's on your resume. And again, no organized team player. I don't want to ever see that on a resume. Okay, I don't want to ever see smiling face. I've seen people try to do that thinking it's cute. It's not. It's not. We want the everything that's on our resume is going to be it's very limited in space as it is. So each line that you're working with, it needs to convey something very to the point. All right. Now, this person was the reason that this episode was inspired. So let me read her comment. And she says, I started in patient accounts, which is like billing, right, within my healthcare system, and then got my CPCA certification. I moved into an insurance follow-up position. And after this, since I have my certification, I have been able to work coding denials and complete corrections and work with the coding department on projects. Now I am struggling to get out. Translating the current work I do into coding experience on a resume has been difficult. My facility is now outsourcing their coders, and I am now applying externally. Any advice? So the thing about it is, before you panic, don't panic. All right. As far as like, oh, they're outsourcing. Sometimes when organizations are outsourcing their work to an organization, it is because they're not maybe they're in an area that does not have enough skilled personnel in it. So they say, okay, let's let this company handle that, because we don't have the time or the resources or the manpower to find people in the area that are qualified. Okay. And the other reason that they do that is, when you work for an organization, it's not just while you're working there. Okay. If you are a lifer at that organization and you spend 20, 30 years at that organization, they're going to have to pay you, if it's part of your benefits package, like your 401k, they're going to have to pay you your benefits and all these good things. Well, these things cost money, and it costs the organizations. So sometimes they think, okay, we have a budget of X amount of dollars, and we're going to give this to this organization that takes care of the coding side. They're going to make sure that we have competent people who can code and do all these things like they need to do, and they're going to take care of their benefits. We don't have to worry about that as an organization, so it's going to save us money. So sometimes that's what they're doing. So it's not all bad. Don't think of it as bad. There's lots of companies out there that are coding companies that are US based. It's not always that they're going to send it overseas. A lot of times when it does get sent overseas, it has to come back, because sometimes there's errors. There's too many errors. Not at every place, but sometimes there is a lot of errors. I've seen errors come back that were the person was coding, it's supposed to be cardiac lead, and they were coding for lead poisoning. So how you confuse the two is because LEAD, lead, you know what I mean? Like that's the only thing that was, I guess, was confusing for them. So that's something that you have to think about. Don't worry about, oh, this is going to go overseas and we're going to be out of a job. It just so happens at this facility that they're just outsourcing it. And again, I don't know if they're outsourcing it, where they are, but I'm going to assume that it's going to be another US based company. Okay. Now here's the other thing too. This person is saying that they're working denials, they're completing corrections, and then they work with the coding department on projects. Now, this is a lot of transferable skill. This is a lot of, okay, if you're working in denials, this means that there was an error that the insurance picked up for whatever reason, and then it was sent back. And then they have to look at it. The biller or the coder has to look at it. In her case, she's the biller, and she's looking at it, and she's like saying, okay, well, this needed a modifier, or there's a more specific code that was available here. So let me go ahead and correct this, and then send it on in. Now, again, you're not doing production coding. Your title is not a coder, but it does not mean that you don't have anything that can transfer over. That is clearly something that can transfer over. If you're having to do research about denials and you are applying the correct codes and you're changing and updating the codes and maybe you're adding modifiers, that's what you need to put onto your resume, okay? That's something that's worthwhile, all right? That has a lot of weight to it because, again, when you're working denials, you're having to look for those errors and you're having to look at why and make those corrections and find a better fit, So that's something that is very good and transferable to put on your resume. Again, your title does not have to be coder in order for you to have some kind of transferable skill. And any of these coding projects that this individual was helping on, I would recommend that you are very specific about what coding projects, which specialty was this? Was this for the mother-baby clinic? Was this for the ortho clinic? Was it for the ER? That's what you need to say specifically, because now if I am a hiring manager and I'm looking at this and this person says to me, well, I worked on this coding project. I was helping with the backlog for the emergency department and I was applying ICD-10-CM, CPT, and HCPCS codes, those kinds of things. Okay, this person's coded for the ER before. So this means that they've applied evaluation and management. They've applied procedure codes. They know about diagnosis coding. And we understand the modifiers that apply here. So that's the thing that I'm going to see as that hiring manager. So this person is going to say, okay, well, this person has good transferable skill here. We can go ahead and send them an assessment test. All right. Now, even if you didn't do that as a in this type of position, maybe you were just doing the billing and maybe you did not do any corrections. Maybe you kicked it back to the coder to do that. Well, if you did that, you're still having to get the claim back from the insurance company. You still have to inform the coder on what was a denial about, and they have to look at it and correct it or whatever, and then you have to end up sending it back in. You're still exposed to the codes. It's not like you're not. And it's not like you don't understand, okay, well, this insurance company, they want this kind of code. They want a HCPCS code instead of a CPT code. You know all of this. This is very powerful coming into a coding position because, again, coders know the coding, but billers know the billing and they know about those insurances. So if you're saying, I have knowledge of government programs like Medicare and Medicaid, and you have worked with commercial insurance like Aetna and Blue Cross Blue Shield, that's something that's, again, very powerful, very motivating, and very wonderful to see as somebody that is a hiring manager. Okay, well, this person has that knowledge coming in. Okay, we use Blue Cross Blue Shield. We use Aetna. We see Medicare patients. We see Medicaid patients. Again, that's going to be something that is, okay, this is somebody that's going to understand what we're doing here. What kind of electronic health record did you work with? Was it Epic? Was it Cerner? Those are things that need to be put on there. eClinical works. Again, that is very valuable real estate on this one page. And it doesn't have to be 50,000 things, but it does have to be the most important things. Which electronic health record did you work with? Okay. I don't care that you answered phones. I don't care that you set up appointments. I don't care. I want to know how much exposure to these codes did you have? And you need to write that down. And if you had to help with a backlog or something like that, that's what you need to tell me. I don't need to know about any reports that you ran. I need to know about what it is with the coding that was relatable. Did you protect private information? Which leads me to my segue into my folks that don't have any medical background, but you're thinking about your transferable skill. Everybody's coming in with transferable skill, some level of transferable skill. Everybody is. Doesn't matter what your job was, right? My school teachers that are getting into coding. Did you talk about any with strangers willy-nilly about these kids and their problems and their issues? No, you did not. You protected your student information, all your students. You protected them and their information, their identities and things like that. So that's something that you can put on there. Additionally, now let's think about this. You are coming from a teaching position into a coding position. Coders, not all the time, for those of you, again, that think that you know everything, right? But there's some positions as the coder that you're going to have to be the one that's educating the provider. Some, don't panic. Some of you will not. Some of you will just be put into a corner and say, okay, go ahead and code. We have an educator for that, but not at all places. And this isn't a task that you should run from. Everybody should know how to educate. If you're coming in as an educator already, whether it is that you taught at a school, whether it is that you taught at a Sunday school, that is something that is a transferable skill, that you know how to teach adults. And that is one of the most underrated skills that people just don't even think that they have, right? And when you have some kind of skill like that, it is very valuable, because this says that you're not going to be afraid to send queries. You're not going to be afraid to do all the things that when it comes to communicating with these alpha personalities like these providers are, that you won't be afraid, and that you will be willing to share this information and keep them updated, because it is important for you to keep the providers updated, especially when it comes to updates. So again, if that's something that you're coming in with, a teaching background, and again, it doesn't have to be formal. It even could be that you were a Sunday school teacher. But if you're saying that you watch these people and that you were able to explain things in a way that would help them to understand, even if it's patient education or even if it's customer education, this is something that needs to be put on to your duties for your job, because these are transferable skills. Okay, so even if you worked in retail and you were teaching them about how to work their TV or work the remote or whatever, that's something that you can put on there. If you're bilingual and you had to do this in English or Spanish or English and Japanese or something like that, you can put that on there, okay? Because you never know what that facility or who that facility, what community are they serving, right? As far as like if somebody has a barrier to English, that kind of thing. Those are the things that you can put onto your resume. Okay, so protecting private information, teaching, those kinds of things. If you worked in retail and maybe you were dealing with the customer service and you had people that were upset and you were able to diffuse those situations, again, that's something that you can say on there, that you helped to diffuse situations before they got out of hand. If you did housekeeping, obviously, if you are being trusted enough to have the keys to people's homes and you were protecting their home while you were there cleaning, again, something that you can put on as a transferable skill. And for those of you who have to, any kind of health department that you had to report to or that you had to get a certificate through, whether you handled food or whether you were like a beautician or something like that, those are things that again are transferable because you had to follow those regulations. Well, guess what coders have to do? Follow regulations, follow guidelines. So OSHA has their set of guidelines, and if you're working in housekeeping, you can't be mixing chemicals. Okay, certain things you can't be mixing them together, and you know that, and that's trained in you. So again, that's a transferable skill. You know how to follow regulations. There's so many things, guys. And again, if you worked at the Dollar Tree, Dollar General, any of these places, and you were looking at the orders that came in, you had to look at the manifests, you had to look at the spreadsheets and things like that, and you had to do the inventory checkoff. Again, We have to know our numbers and our letters as coders. And doing that will also say, okay, this person knows how to accurately make sure that, and they check and verify, numbers and letters and things like that. That is something that is transferable. Okay, so again, something for you to know that you have a lot of skill, and you shouldn't be discouraged, and you shouldn't wonder like, oh my gosh, how am I going to translate this? Did you work with any coding? For my coding adjacent folks, yes. Say what you did about this coding. Don't be general about it. Don't say outpatient. Was it radiology? Was it anything in the ER, anything of those kinds of things? That's what you want to put onto your resume, okay? Now, you don't have to list every single thing, but you do need to be like very specific as far as like any of the clinics that you had coded. If it is a lot, go with the ones that you did the majority of the work in, and then everything else will fall in line later on, okay? So that's just something that would be my advice anyway. But you're not trapped. You are certainly not trapped in any of these positions. I had done a post a couple weeks ago talking about that you're not trapped. And this lady was like, oh, I feel trapped. I'm in a patient access position and I'm just trapped. Okay, no, you're not trapped. You are just not, you're just too scared to apply for another job. Or if you are applying for other jobs, your resume is not right, okay? There's nothing wrong with it. We're not taught in school how to write resumes. And even if you did do a resume exercise in school, it doesn't necessarily mean that it's going to apply to what you're doing today, right? So that's just another thing that you have to realize. When you're looking at what this employer is seeing, we need to see all of the skills that you've gained while you're in school. Now, if you say, well, I don't have any experience in that, that's why I didn't write it down. Again, you're just limiting yourself. This employer does not know what you learned in your school. All right. And if you say, well, it's just common sense, why would I put it down that I learned ICD-10-CM? Again, guys, this is something that is going to help you to get picked up in the reader, in that ATS reader, that you're putting it on there correctly. And yes, you can put the dashes on ICD-10, ICD, and then the dash, and then 10, and then dash CM. That is correct. That is the correct way to write it. I have to say this because somebody asked me about that. So I will say that is the correct way. What I'm saying is don't do only ICD-10 and then nothing else, or ICD-10 CM/PCS, because there is no CM/PCS. Okay? So that out of the way. That's something that you should know. So with that said, you have a lot more skill than you're giving yourself credit for. Stop limiting yourself because you think it needs to be this way, that way, okay? And again, even though your title does not say medical coder, it's not going to stop you from saying that this is what you did in this position, because coders are called different names. Even my job title does not have coder in it. It does not have the word coder in it. My official job title does not have coder in it. But that is what I do. And that is what my facility calls us, right? So that's something that you have to know too, that these facilities are always going to use different names for coders. And sometimes they call them revenue cycle managers. And it's not, what do you mean, manager? But it's just people that are doing the coding, so they manage the revenue cycle is how it was explained. So I don't know. But anyway, but yes, that's my advice, guys. Write the resume yourself or get somebody to write it for you. Make sure they know what they're doing, okay? Because you get what you pay for, all right? For those of you that want to, I only want to spend, a couple dollars or whatever. Well, you get what you pay for, just so you know, all right? I'm not saying that you have to go and do all of these things, but what I am saying is this. The resume that you're putting out there is the first thing that these employers are seeing. So it needs to be to the point and direct right away. It does not need to be repeating things. If I see things that are repeated, it's going to irritate me. And I'm not even a hiring manager, but it would irritate me if I saw things that were repeated. You know, not every position that you did is going to be very different sometimes, but there are different things that you do in those positions. All right. And the other thing is this: when you are writing your work history, it only needs to go back 10 to 15 years. If they need more work history than that, they will let you know. But other than that, they don't need you to be saying, well, I did this in the 90s. The stuff in the 90s and the early 2000s does not apply because everything is different now. Okay. So only the last 10 to 15 years is all you need on your resume. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see you all next time. Bye.